The number to WhatsApp 430-1043. All right. Let's see if you gotta unmute. Don't forget that. So you go back into the browser there, and you click unmute. All right. All right. Perfect. Perfect. I can hear you now. Good morning. Testing.
Hi, good morning, Good morning.
Okay, lovely. All right. So we are joined this morning by Dr. Jozelle Miller, who's a health psychologist, and Dr. Erica Jordan, who's a general surgeon. And we're going to be talking about the physical and emotional effects of breast cancer. Good morning and welcome to the wake up call. Jozelle, no stranger.
Well, thank you so much for having us.
Not a problem. Not a problem. Welcome, Dr. Jordan. The first time you're joining the wake up call.
Yes, it is. Thank you for having me today.
Sorry?
Yes, it is. Thank you for having me today.
Oh, okay, not a problem, not a problem. Always a pleasure having guests inside to share some important information that we can all use. Now, we're going to be talking about breast cancer. I think it's quite self explanatory to explain or to define what breast cancer is. Is there anything else you can add besides, or maybe expand on what breast cancer really means?
Well, as you said, it is pretty self-explanatory, but it is a cancer, a malignant disease that affects your breast tissue. It is
Mm-hmm,
found both in males and females, but it
mm-hmm,
affects the female population in a greater percentage.
mm-hmm.
Worldwide, breast cancer is the most frequently diagnosed life threatening cancer in women, and it is the leading cause of cancer death amongst women. And in St. Vincent, it is the leading cause of death by cancer in males.
Wow, that is some interesting statistics there. And SVG is the leading cause of cancer death, regardless of gender.
In females,
Oh, in females. Oh, okay, okay. So
yes.
we're just focusing on females because it affects females more. A lot of people are of the opinion or the
Yes.
misconception that it's just women, but you said,
No, it affects both sexes.
mm-hmm,
Just men in a lesser percentage because they have less breast tissue than females will. But it can affect both sexes. And the thing is, normally when it affects men, it is a more aggressive form of cancer, but it affects both sexes
why is it more aggressive if it affects the man?
because men have smaller breasts and men tend to think that breast cancer will not affect them. So when we do diagnose breast cancer in a male, it is typically a very advanced breast cancer. Also, when you find breast cancer in a male, they tend to have different genetic markers and different gene abnormalities that causes their cancer to be more aggressive.
Wow, that is rather interesting. Man, I hope that you are listening. So, in terms of identifying when a woman has or man has breast cancer, is it different between men and women? Like the signs and symptoms?
No, basically the signs and symptoms are the same. It's just that men typically tend to ignore breast lumps more.
Okay. So, what should we be looking out for as women in terms of identifying early breast cancer?
I like that you use that word identifying early because late detection is the leading cause of poor prognosis in St. Vincent right now. It is not that you cannot manage breast cancer because it is a cancer, but with early detection and adequate treatment, we can have a good outcome.
Mhm.
However, our breast cancer here in St. Vincent and the Grenadines is being diagnosed too late. And because we're diagnosing it too late, we are having a very, very poor outcome.
Mhm.
So I have a few points here that I just want to get out to the general population
Mhm.
when it comes to breast cancer. The first one is know your family history and know
Mhm.
your risk factors. Breast cancer can be sporadic. That means that it can appear in any female, it can appear in any male. But there are certain risk factors and there are certain genetic markers that can be passed down through the family that gives you a hint on if you may develop breast cancer. Now, if you're a female or a male and you have a family history, your grandmother, your mother, your sister has had breast cancer or ovarian cancer, you need to be concerned.
Okay.
If you have certain risk factors, if you had early onset of menstruation, if you had a late menopause, if you never had any children or you had your children later on in life, those are risk factors that can severely increase your likelihood of having breast cancer. And why I stress on family history, because if you have a first generation family member that has had breast or ovarian cancer, you are 4 times more likely to develop breast cancer in your lifetime.
Mhm. When you say first generation, you mean
Second,
mother?
mother, sister.
Okay. 4 times is likely. Okay. Whew. Boy.
Yes. Yes, it is.
What,
It is alarming.
what are the chances if your grandmother had, but maybe your aunt would be considered first generation too?
Yes, it will. In that sense, it is because there's a carrier gene that is related to breast cancer. That is the breast cancer gene, BRCA1 and 2. And that is transmitted throughout the family. So you tend to find that your grandmother may have had breast cancer at 70. Your mother or your aunt, a direct relation to your grandmother, may have presented with breast cancer at 50. And you as an individual may present in your late 30s or 40s because it tends to get present at an earlier age in subsequent generations. So that is why knowing your family history and knowing if your grandparents, if your aunts, if you should tend to know if your mother had, but you understand what I'm getting at.
Mhm.
Knowing if anyone in your family been affected by breast or ovarian cancer is very important.
Okay. Now, you said earlier, right? If your mother or
Mm.
grandmother had at a certain age, it would present at an earlier age. From what ages should a woman start looking for the signs or start testing themselves or start doing or start checking?
You are leading me into my second point. Remember, I said my first point was know your family history. My
Okay.
second is get to know your breasts.
Get
Your
to know your.
breasts develop, get to know your breasts. Why I say that? Our breasts develop as children and they pause. And then when we approach puberty, you really start to get breasts. But the thing is, when you develop that breast tissue, then you do not have the likelihood of developing breast cancer. I'm not saying that is 100%,
Uh-huh.
but I encourage females, as long as you actually have breasts, and I am talking about 12, 13, and right now we have some even 10-year-old, 11-year-old girls that have well developed breasts. And I try to encourage all females from as early as possible, from the time you have breasts, get accustomed to knowing your breast and knowing how to feel. The breast examination is suggested from 20 years of age, where you start doing what is called your self breast examinations. That is where it's recommended that once a month, typically after you finish menstruating, because at that point the breast tissue is softer, it is easier to be manipulated. You start to examine your breasts. You do it in the shower, you can do it laying on the bed. In the shower is easier because you can use the soap, so it helps your hands to glide over your tissue easier. And you
Okay.
basically get to know the feeling of your breasts. Because you know your breasts, what I would like the population to understand is if you learn to know how your breasts feel, any changes, you first can detect them.
That is true. That is true. You know, as you mentioned that something that I learned is that some women have naturally lumpy breasts. So how does a woman who have that sort of breasts really? I mean, she would know her breasts, but how does she identify? Oh, there's an extra lump today. How do you maneuver? How?
Why I stress the self breast examination, some females naturally have the best.
Hmm.
Some females normally, and it's normally this is something that's called polycystic breast syndrome, where you can have a grainy breast. There are benign breast diseases that actually make your breast feel like a kind of like a sack of peas,
Like a sack of peas.
like a bag of dried, yes, like a bag of dried green peas that you can feel several little lumps in your breast. But when you get to know your breast, you get to know the feel of your personal lumps.
Uh
And
huh.
any lump that is increasing in size, the texture or the shape of our breast starts to change, then you are aware because it is not something that you are accustomed feeling. When you look at your hands, sometimes we look at the back of our hands and you know your hands very well. So if you see a mark or you see a bruise, you recognize, well, this wasn't here the last time. And this is the point that I am trying to make when I stress that getting to know your breast is important and getting to know your breast from as early as possible. I'm just going to use a personal experience here.
Hmm.
I had surgery for a benign, that's a non cancerous breast lump at 13 years old. And I diagnosed it because I was literally laying on my bed, examining my breast, and I noticed, wow, something is wrong here. And I was very afraid. I was totally freaked out. I went to
Hmm.
the doctor, we did the procedure, and it was a benign breast lump. But I am just trying to say, if at 13 years old I was able to self diagnose a breast mass, what can we achieve if we get the general population to examine their breasts monthly?
Hmm. How do you examine your breast? Do you just like cup it? Do you? What do you do?
No.
Can you explain that without showing
The
it?
first thing,
Or maybe you should show it. I don't know how you're gonna do that, but could you explain for the listeners' benefit
I'll
here? How do you
try to
examine your breast?
explain
Yeah.
as best as possible. The first thing in examining your breast is looking at them.
Okay.
Literally standing in front of a mirror naked and looking at your breasts.
All right. Okay.
When you look at your breast, what are you looking for? Remember, they are sisters, not twins. So they can be slightly different. One is generally slightly bigger than the other. One may have
Okay.
a slightly different shape than the other. But you get to know that by frequently inspecting your breasts. You put your hands in the air, you put your hands in your waist, you lean forward, and you look to make sure that the shape of the breast, the contour of the breast is basically symmetrical within the two. Now, your breast tissue runs from your clavicle or your collarbone to the top, to your sternum or your breastbone in the center, to that crease at the bottom of your breast, and the end of your breast extends into your armpit. Now, a lot of people misdiagnose or they miss breast lumps because they forget that your breast tissue actually runs and extends to your armpit. And that zone, that upper outer part of your chest, is actually the most frequent location for breast cancer. So when you're examining your breast, what you basically do, that's why I recommend that you do it in the shower when you can have some soap or laying on your bed, and you run your hand against your breast, gently pushing it against your chest wall from the collarbone right to the breastbone, to the bottom of the breast, and right out to under your armpit. That is the first wide circle. Then you do the same thing in smaller circles and smaller circles until you reach to the nipple. And you actually are supposed to squeeze your nipple to see if you are having any breast, any discharge from the breast. Now, everyone does not have nice turgid breasts. As you get older, the breasts get more pendulous, they hang more. And when you have quote unquote floppy breasts, it is easier to take your breast between your two hands. One breast laying to the bottom, one hand to the bottom of the breast, the other hand to the top of the breast, and you feel the breast tissue between your fingertips. Yes, just how you're doing it, but fingertip to fingertip.
Oh,
And you feel the breast tissue.
sorry, not your whole hand,
Not your whole
fingertip.
hand because it's more sensitive.
Okay, right. So fingertip like that.
Mm.
Some
Or
women or
before you
breastfeeding as well.
have
That
your
might make a difference in the texture and the shape of their breasts too. So it might become easier after a couple of children. Yeah. This is rather interesting. I hope you guys are paying attention and taking notes. Remember, if you have questions, feel free to share them at 457-1043. We actually have a call, so we're going to take this call at this time. Right? So if you have questions,
go ahead.
430-1043. All right, let me see if we can take that one again. Hello, good morning. You probably have a question.
Good. Yes, I want the doctors to help me. Good morning, doctors. And I don't know whether I didn't do any tests recently. There's no lump in my body, and same thing with my wife. But I want to just speak to you is that one of the things bother me, doctor, is that what we know as human beings is that if we eat properly, we give ourselves a best chance to save ourselves from cancer. If we don't eat certain foods, we are going to develop the risk. We have so much, again, genetically modified food that put us at a very serious risk. But there's another very serious issue that affects people with cancer, and that is HIV. And so it's significant that we continue to help the public to be able to stay healthy, eat right, eat properly, get a balanced diet, and also to make sure do everything to avoid this HIV from getting into your system.
Okay.
And doc, please, I beg you all, because sometimes, really, there's really nothing you could do. Sometimes mother and father, they're literally, they have the case of having a cancer, and nothing happens to anybody.
All right.
And the other way it happens. So we can do things to minimize our chances of getting sick. And this is
All
what
right.
I want the doctors to be there for, to
Okay,
help
so
us.
what you are sharing there, you
Yes,
are
sir.
actually asking them if
I'm
that is true.
asking them,
Asking them if that is
if
true.
they
All
can
right.
use the office, the highest, authority
Okay.
to influence the authority, to help us to eat, a
Okay.
balanced diet, to
All
help
right.
to tell us whether these genetic stuff
Okay.
is
I
getting
think they get a general
done with
idea.
you.
All
Thank
right.
you very
So
much, doctor.
they would answer. So he spoke about HIV and he spoke about foods. Can you expand on that, please? Because I am pretty sure that other people were listening and probably have the same idea. So let's start with food and then we can go over to HIV.
Now, food. There are several studies that show that our eating habits can affect the inflammatory process in our body. But that is a long conversation and a very in-depth conversation. There is research. I was actually recently studying a publication by the Harvard University of Medicine that shows how foods can affect inflammation and how the inflammation process can promote the spreading of cancer cells within your body. So he is correct in that a balanced nutrition, a healthy lifestyle can decrease your risk of suffering from certain diseases. And it's not just cancer, it is all non communicable chronic diseases. So we strive for a healthier lifestyle. However, with regards to cancer, nutrition is not all. There is a link between obesity and breast cancer, principally
Okay.
because obese people can have more estrogen in their body because estrogen is actually a byproduct of the breakdown of fat. So
Oh.
older obese people are actually more likely to develop a cancer, especially after menopause. However, to say that just nutrition can cause or hinder cancer is really minimalizing the whole issue because there are other risk factors that are actually a lot more important.
Mm-hmm.
With regards, just let me clear up a misconception.
Mm-hmm.
HIV AIDS has nothing to do with cancer and the development of cancer in your body. People that have HIV AIDS, because they already have a weakened immune system, if they do have cancer, you have to be very careful with how you treat their cancer because their weakened immune system can affect their body because cancer also weakens your immune system. But there
Mm-hmm.
is no direct correlation between being infected with the HIV virus and having AIDS and developing cancer. I hope I was able to clear up that point.
I think you were spot on. The way he shared it as well was so anyways, let me just leave that there. Somebody says happy breast cancer month and happy independence. But here's another one here. Somebody's asking if the breast has a little fluid when squeezing it, no lumps in the breast, but pain. Is that an indication?
Okay, I am going to do my third point. Remember, I told you there were a number of points. Know the warning signs for breast cancer.
Uh-huh.
There are a number of warning signs that alert us that something can be wrong with our breasts. Firstly, remember I said that the first part of your self breast examination is inspecting your breast. You are going to look for changes in your breast size or your breast shape, dimpling in the skin,
Like dimples in
bunching
the
up the skin. Sometimes the skin actually starts to look like an orange peel. You know, literally how an orange peel
Oh, like
looks.
that. Yes,
The
yes.
skin, yes, the skin actually starts to change. If you normally had nice smooth breasts that you never used to see any veins superficially, and you notice that you are getting some dilated veins that you are seeing in your breast, be concerned. If you have any small ulcers developing in the skin, or if your breasts to you typically look swollen, especially if one of them looks more swollen than the other, those are things in when you're inspecting your breast to be concerned about. Skin
Mm-hmm.
changes, shape and size changes in your breast. Your nipples becoming inverted. Some people typically have flat nipples. Some people typically have slightly inverted nipples. But if you normally had nice erect nipples and you notice that your nipple is starting to get drawn back or get pulled in, that is a sign of breast cancer that is laying directly below your nipple because
Oh,
it
wow.
pulls on the nipple and it causes the nipple to sink. So
Wow.
inverted nipples are of a concern. Now, to touch directly on the question that was asked, nipple discharge. You notice when I did the breast examination, the self breast examination, I stated that you finish the examination with actually squeezing your nipples to see if you have any discharge.
Uh-huh.
A clear or milky discharge from more than one milk duct can be normal. It typically is normal because our breasts are secretory tissues and they secrete milk. They literally
Uh-oh.
have.
All right. Hold on. There's something going on there. Perhaps I gotta sort that out. And we good?
Yeah, we get.
All right. Okay.
Sorry about
Whew.
that.
That's all right. That's all right.
You you have several breast ducts, minimum of 20 breast ducts, 15 to 20 actually, that
Mm-hmm.
lead up to your nipple. So when you squeeze your breast, it is normal to have little drainage, little beading from more than one spot. Now, if when you squeeze your breast, you are finding that you are having a dark or a blood tinted discharge coming from one particular breast duct, that is an issue of concern. So notice I'm
Okay.
saying again, if you squeeze your breast and you're having a clear or milky discharge coming from more than one point, that is typically not a sign of concern. However, if you are having a dark or a blood tinge discharge and constantly coming from a particular area, that indeed is a sign of concern.
Mhm. The
Breast
person,
lumps.
sorry,
Go
the
ahead.
person spoke about pain as well. Pain in the
I'm
breast
getting
is
to that.
automatic. Okay. All right.
Breast cancer in the early stages is not painful. When breast cancer becomes painful, we are typically in the presence of an advanced breast cancer. Normally, the lump that you look for is a hard lump. It is solid. It tends to have irregular borders. You can't really define the lump from the rest of your breast tissue. You know it's there. You can feel the hard lump, but you can't move the lump by itself. Why I specified is because there are benign breast disorders that present with lumps, but that lump is solid. It is very smooth. It has nice smooth edges, and the lump moves a lot. That is not the breast cancer lump. The breast cancer lump is hard, undefined edges, and it can be fixed to your skin or your breast tissue. That means when you move the lump, your entire breast tends to move with the lump and not just the lump itself. And the next
Okay.
one is an axillary lump. You see, I said that the breast extends up into your armpits. Some
Mm-hmm.
people present with the lump in their armpit and not necessarily their breast.
Serious.
Yes, our misconception of what the breast is that those two lovely masses to our anterior chest wall, the lump doesn't always present there. It can present in your armpit. And as I said, your breast tissue extends into your armpits.
All
So
right.
those are the signs.
Okay, so before you continue, because there's so many things that we could talk about concerning breast cancer, we have to touch on the emotional side of being diagnosed with breast cancer. But when we come back, because we have to take a break right now, so we're gonna stick a pin there. All right. If you're just joining us, we have Dr. Erica Jordan, who's a general surgeon, and Dr. Jozelle Miller, who is boy, Giselle, I'm so sorry, but honestly, a health psychologist. All right, a health psychologist, and to think I know you for such a long time,
Yes.
and it always looks to be a health psychologist. All right, so we're going to be dealing with both sides of breast cancer this morning. You would have heard the physical side in terms of what to look for, who it affects, the rate of infection. Well, not specifically a figure, but how so many women find it out at a late stage in St. Vincent and the Grenadines. All right. But when we come back, we're going to go off on a little bit more, but we have to take a break at this time. All right. Somebody says, Michael says, good morning. Pauline says, thank you very much for your information. That's the same person who asked the question that I was shared with you earlier. All right. All right. So we're going to take a break. We're going to end the live on Facebook and we're going to come right back. If you have any questions, feel free to share them on